Is going to be addressing us at the end, and we'll have a chance to, again, thank him for everything he's done. Another thanks to the wonderful people who have been organizing this, but particularly Shilpa, B. Jane, Judy, where'd you go? Thank you to all of you. Thank you, guys. You stick till the end. We do have a reception at the end, so please join us for that reception. But I want to really give the stage over to our phenomenal guests here on my left. Maricela is about to join us. We're first joined by Maricela Gutierrez, who is Executive Director of Services, Immigration Rights, and the Education Network, or SIREN, which is an advocacy and community organizing nonprofit providing immigration services to low-income residents of San Jose. She has more than 20 years of experience in grassroots community organizing and previously worked as the director of a federally qualified community health center in the East Bay, advocating for accessible health care for all. She's a graduate of UC Berkeley and a founding member of Unaccompanied Immigrant Youth and Families Collaborative and the Soñadores Invencibles program that works to develop safety net systems for children and families seeking asylum. She also serves as chair of the statewide Chicano Latino Youth Leadership Project. Dr. Dana Weintraub is clinical assistant professor in our Division of General Pediatrics and a staff physician at the Gardner-Packard Children's Health Center that Raimundo Espinoza spoke about earlier, where we serve low-income children in immigrant families and provides a training site for our pediatric residents. Dr. Weintraub is also co-founder and co-medical director of the Peninsula Family Advocacy Program, a medical legal partnership with legal aid of San Mateo County, Ravenswood Family Health Center, San Mateo Medical Center, and Lucille Packard Children's Hospital. And Dr. Weintraub's research interests include the impact of medical legal collaboration on child and family health. She's been a leader regionally and nationally in the Medical Legal Partnership and served as an assistant national medical director from 2008 to 2010. Stacey Hawver, to her side, is executive director of Legal Aid Society of San Mateo County, a well-known advocate on behalf of low-income residents of San Mateo County. She has received the San Mateo County Women's Lawyers Section's Eleanor Falvey Award for service to low-income families and seniors, and was named by the Silicon Valley Business Journal one of Silicon Valley's Women of Influence. She joined Legal Aid as a staff attorney in 1990 and became its executive director in 2002. She graduated first in her class from Stanford Law School and has also master's degrees from the London School of Economics and an AB in economics from Cornell. And then finally, and last but not least, is Lisa Chamberlain, an assistant professor of pediatrics in our Division of General Pediatrics and newly named associate chair of, let me get this right, community engagement and policy. Is that correct, Lisa? For our department. She also founded and directs the Stanford Advocacy track for pediatric residents, and her research focuses on access to care for all children in California, particularly those who live in poverty. She's had a number of regional and national leadership roles, and most recently helped lead the the American Academy of Pediatrics National Strategic Initiative on Poverty and Child Health, and has received numerous awards, including the inaugural recipient of the Institute of Medicine's Award for professions for the physician. It's the Professions Physician Merit Award. Getting this right, sorry, Lisa. She's also a primary care provider for patients in East Palo Alto, and we're really lucky to have all of these members. I'm going to let them take it away. So first, Maricela, thank you.
So good afternoon. We are last, but a group of women, powerful women, so. I'm the minority because I don't have a MD or PhD, but I do have a PhD in grassroots organizing, and that means a lot to my community. So I'm Maricela Gutierrez. I'm the executive director of SIREN. We're an immigrant and refugee rights organization based out of Santa Clara County, but we also serve the Central Valley and Central Coast. We provide free legal services to the community. We also do policy advocacy, local, statewide, and federal policy, as well as community organizing with young people and immigrant adults. I don't know how to use this clicker, actually. So did I just do the arrow?
Yeah, you can use the arrows. Or you can use the arrows.
Okay, there we go. Yeah, so today I'm just going to talk. I know that you've heard about different policies that are happening throughout the country that are really targeting immigrants and refugees. And I know you've heard a lot of it, so I don't know how much you've heard because I wasn't here earlier today. So excuse me if I'm being repetitive to what you've already heard. But really, I'm going to be discussing more from an advocacy perspective of what I feel community health centers, health organizations, mental health organizations can do on the ground right now as different policies are enacted. I know every day we wake up and look at the newspapers and see, what is President 45 thinking about today? And so we're always ready for the battle. Siren's been around for 30 years doing this advocacy work, so we're celebrating 30 years this year. And so I stand on the shoulders of leaders and founders that believed 30 years ago that Siren needed to be around. And what a better time to be around and to use our tools than today. And I say Siren was created for this moment. So yeah, just a little bit of an overview on the executive orders. So as you guys know, there's, sorry, that didn't change. I'm not good with this stuff. The three executive orders have been signed. The travel ban against Muslim communities. As we know, there was the Fourth Circuit Court strike down the Muslim ban today, which is great, a great defeat for the organizing and the grassroots advocacy that many organizations like Siren have been on the front lines advocating for. And so I want to give an acknowledgement to that work that today another defeat happened. And we know that this Muslim ban is just a clear example of how the administration uses politics of fear and hate to further discriminate against people. And this proves that you cannot discriminate against people because of the way they pray. And for us, that's very important as immigrants and refugees that come from different cultures and countries and different religions and different faith-based origins, and all of that should be respected in this country, and those are the values of this country. And so today we stand here really excited about another defeat. And then I'm going to talk about just the increased number of deportations that we're seeing. I know that under President Obama, there was a huge number of deportations that were happening, but this is a different type of deportation that we're seeing, and how that's really affecting the psychosis, the trauma, and the vicarious trauma that's affecting many of the young people that we work with and the families that we serve every day. Sorry, did that change it? Yeah, so as far as the enforcement priorities, what we see is that anyone's at risk for deportation. So what we're seeing is a slow, gradual, mass deportation of immigrants and refugees. So previously, the communities that are being targeted right now, we're probably at the bottom of the list of someone that might be deported. But what we're seeing now is that ICE is showing up at people's doors, whether you had a minor criminal something in the past 20, 35 years ago, now they're showing up at your door saying, we have a deportation order for you. And I'll give you an example in a family that we're working with. One of our young people who's in our youth organizing program called us really early one day, about 2 months ago, saying, I showed up in our front lawn and took my dad. And so we organized immediately. By the time we organized and got legal support and advocacy, her dad had already been moved from Morgan Hill ICE Detention Center to Contra Costa. So by the time we got lawyers down to Contra Costa, he already had been moved to San Francisco Detention Center. And then we called and got talked to the local DA there and got legal services as well organized. And then he got moved back to Contra Costa and then back to San Francisco. And so by the time the family finally found legal defense, he was on his way to San Antonio. And he's still in San Antonio today. And what was this crime that this father of 4 and grandfather of 4 grandchildren do? He stole a box of tile as a teenager when he was working for a tile company so they could fix his mom's bathroom. And so he served time 1 year in jail and he paid his fees. But now he has this deportation order for him to be removed from his family and ripped away from his children and his wife and his grandchildren. And we've been doing everything in our power to return him back to California, because we feel that, you know, the laws are still a bit stronger, and there's people that are more progressive in California. And knowing what is happening in Texas, it makes it really hard for us to really track him down. But that's some of the work that Siren's been doing, is really working with families that we're getting calls from that are being deported for small incidents like that. And so for us, it becomes more of a urgent issue to really rally and create a form of resistance. So what we did form is a rapid response system, a texting system where families or children or anyone in the community, if you see ICE come to someone's door, or if you see ICE conducting a sweep in a local supermarket or whatever that may be, or if it happens to you right at that moment, you can text the number. And we've organized and trained community advocates that include pro bono lawyers, social workers, individuals that can do advocacy and show up at the ICE office, or also come and support the family in case the children are going to be left alone, or like the situation that we saw in LA, where the dad was dropping off his daughters to school, and he was pulled over and deported in front of his children before he dropped them off at school. And they recorded it, and they put it up on Facebook. Otherwise, we wouldn't have known about this situation. But that's the type of deportations that we're seeing. Parents on their way to school dropping off their children, and ICE is pulling them in front of their children. And so at that, the texting platform would allow for anyone to text the number saying, ICE is here at my door. We would rally our advocates to come and show up and protect the families and show up for legal defense. And the texting card is actually in the back, so if you guys wanted to grab some before you go home or share them with your clients, please feel free to do so. So I'm going to skip over. Sorry about that. Oh, sorry. Okay. I cannot read it, that's why it's so tiny, sorry. So let me look at this way. There it is, sorry. I don't have glasses. Let me skip the Muslim ban since. So what can health-serving organizations do? Really look at policies that are currently in place in your community-based organizations, community health organizations or mental health organizations, to ensure that all people that walk through your doors feel welcomed. Many years ago, I worked with a community health center, and I was working to support unaccompanied minors who were walking through our doors, and no one knew how to support them. They came with an immense amount of trauma, an immense amount of needs, and none of them were ready to be transitioned into traditional school systems. Many of them had probably third grade level reading, and really didn't want to be put in a place where they didn't speak their language. And so we implemented a program where they were legal providers were on site at the community health center once a week, and were able to do intakes with the unaccompanied minors and assess their healthcare needs, and also assess their legal needs, and provide wraparound care for these young people that were in support. And the way we did is we created an intake system that asked them, what country did you come from and how long have you been here? And that's the way we were able to identify these families and these young people that had just arrived from places like Honduras, Guatemala, and El Salvador. Also connect, undocumented patients and their families with legal rights and community organizing organizations. There's many organizations doing Know Your Rights trainings, inviting them to your clinics or organizations to conduct the Know Your Rights trainings, to do the family emergency planning. Sirens probably doing about 100 presentations a month in community health centers, clinics. We've also set up shop at Mi Pueblo stores all throughout Northern California, because it's important to bring services to where the community's at and not expect them to come to you. And so what we did is we're setting up tents in front of Mi Pueblo in a collaboration to do legal consultations right in front of the store with our attorneys, and also do Know Your Rights workshops. And once they shop, they're going to get a red card. I know many of you have seen the red cards, but when they shop, they get a receipt and a red card that has Know Your Rights. So anywhere in the Northern California stores, folks can now access Know Your Rights cards, where in many places it's hard to find these cards because people work 9 to 5, and most of our nonprofits are open only between 9 to 5 hours, and now people can shop and use those cards. And I know my time's up, so yeah, well, thank you.
While they're transitioning to my slides, I'm Dr. Dana Weintraub, as Dr. Sanders shared, and I'm medical director of our Peninsula Family Advocacy Program, a medical legal partnership here at Packard. And also here is Dr. Baraka Floyd, who's one of our co-medical directors, and then our third co-medical director is Dr. Jennifer Newberry, who's an ER physician. And Kate Stanford, our legal director, is here, and we also have a project coordinator, Francisca Guzman, who is not here today, and of course Stacey, who oversees Legal Aid Society of San Mateo County. So I'm just starting with this slide, and as Maricela mentioned, Siren's been around for a very long time, 30 years, I think you said. We have not been around here this long, but Medical Legal Partnership, as Dr. Harris mentioned earlier, has been around formally since 1993 when it was started at Boston Medical Center. And this cartoon was drawn back then. And so the issues that we're seeing now around immigration are not new, as also many of our earlier speakers have mentioned. When we're in clinic, we have a certain amount of time to spend with the patient. We can alternatively address exactly what acutely they're coming in with, and I'm going to give an example of that in a moment, or we can open up for more questions. So last week, a resident presented to me, and the complaint was red eyes. So she came to present to me, this 6-year-old who came in with red eyes, and she said, I asked some more questions about it. So it seemed like it should be a quick question. She said, I asked some more questions about the red eyes, and it turns out she's had a chronic cough for a couple months, so I actually think it's allergic conjunctivitis. And so it could have been in and out, just treat with the medicine for the eyes and send her on her way. But I said, oh, did you ask any more questions about the living conditions? And so she said, no, that's a great idea. So we went back in there and we asked the mom if what the housing was like. And she mentioned that they lived in an apartment and she was very concerned about mold and that she thought it was likely due to leakage around the windows. And so we have this medical legal partnership, and we understand that there's habitability codes that need to be met. And so we asked if she had asked the landlord to make the repairs, fix the mold, and the mom said, no, I haven't. We said, would you like us to write a letter on behalf, talking about how it's affecting your daughter? Talked about the connection of mold and allergies. And the mom said, no, it's our fault. We should be cleaning better. We don't want any help. And I said, would you feel comfortable speaking with a social worker that's in our clinic right now? And she said yes. So the social worker went and spoke with her, and the mother expressed that she was undocumented. She was concerned about the housing costs in our area. So we could have just treated the eyes and not gone there. But now we're actually helping this family, and at that point she did agree to be referred to our family advocacy program, where she'll learn about tenant rights, that she can't be retaliated against, but she'll also understand her rights as an immigrant, benefits that she can use, et cetera. So our partnership, as Dr. Sanders had mentioned, is a partnership between Legal Aid Society of San Mateo County and healthcare providers. We offer free, accessible legal services. It's also a connection to many community resources. We can call up our lawyers and just ask a quick question about eligibility, how to get red cards, how to connect with Know Your Rights trainings. And then we also do a lot of provider trainings. And ever since the change in administration, we've been doing a lot of trainings around immigration. As I mentioned earlier, we just did recently one for the transplant team. And in each training that we do, we always new issues come up that we help connect families with resources in the community. And then finally, we do policy collaboration around issues that as healthcare providers we're seeing on the front lines, and then our legal aid partners are able to work on the policy issues around. And just to tie it back into the question around patients avoiding healthcare services due to immigration, when we first started the Medical Legal Partnership in 2004, we did a 3-year study of all families that were being enrolled in our partnership. And one of the many questions that we asked pre and post receiving services through the Family Advocacy Program. So these were all families, not necessarily any immigration status, but we asked all families if they had avoided health care for many different reasons. One was, have you ever avoided health care for your child because of concerns around immigration? And again, it could be a reporting bias that not everyone would report that they had avoided because of concerns around immigration, but 19% of that cohort of families reported avoiding health care because, and these were the families that were here, so of course there's lots of other families that are currently avoiding health care. So we hope by providing these holistic services at our clinics that we're helping support our families. And I'm just gonna, and then we also have taught a course, we did teach from 2007 to 2013 that we hope to bring back, which was between medical and law students, as well as we had lots of students from the School of Journalism, School of Education, where they would learn about medical legal issues that impact child health and actually work on policy and cases together. And then finally, what's really powered our partnership has been our Hospital Advisory Committee, and from the beginning, Sherry Sager has been a power behind our partnership, as well as Dr. Mendoza and Harvey Cohen was initially as well, many others. And so I'm going to turn it over to my legal counterpart, but here is iHelp, which someone else was asking about trainings, and we do a lot of trainings for our residents as well as other healthcare providers throughout our healthcare provider partners. And iHelp is just a very easy way of helping train the residents on how to screen for issues that impact child health and that we can help with. And today, Stacey's going to talk some about how we have been supporting patients around immigration.
Yes, this iHelp is pretty general. As you can see, it covers a number of different topics. And until November, we trained on a number of different topics. Since November, pretty much the demand from providers is, can you come and talk about immigration? Which is great. We're happy to be there and provide that service to the providers that we work with. We want to be responsive to the needs, and that's one of the advantages of the partnerships, that medical providers can tell us, our partners can tell us, this is what we need information about now, and we can respond to that quickly. And some of that, I'm going to really talk about at the level of kind of individual and family intervention. As one of the previous speakers was mentioning, there's a whole bunch of different levels of intervention. I know Lisa's going to talk about the more political and systemic issues, so I'm going to focus on family-level intervention that healthcare providers can participate in, really following up on what Maricela started with, too. One of the issues that has been mentioned before is have a policy. A question we always get from providers is, what do we do if ICE shows up? And we can't really answer that. We're not your lawyers as the institution, but you can have an answer to that. And probably you do somewhere, and if you don't, you should. Have a policy, make sure everybody knows at least the basics of it, that is how to operationalize the policy. In our office, we actually created a policy, and then I realized I'm a lawyer, I'd written like a 3-page policy, and somebody said, nobody can operate with that in the moment when ICE is standing there knocking on the door. And so somebody else, fortunately, created a script that's a 1-pager that sits on our back door in big type and says, this is what you say. So that's the kind of thing that I think makes providers more comfortable in knowing that they know what to do. So that's one important piece. There's a couple of questions that come up repeatedly from providers because they're getting them from patients and families. And nobody expects you to be immigration lawyers, but you can ask the right questions and point people in the right direction. One of the issues came up a couple of times earlier in the day around cancellation of removal. There is a widespread rumor that if you have a child with a disability, you are eligible for a green card. As Bill Hing said this morning, it's much more complicated than that. It's a discretionary type of relief that requires you to prove a very high level of hardship, and in order to affirmatively seek that remedy, you are putting yourself into deportation proceedings. It's an incredibly risky strategy, but there are people out there who are advising your patients that that's a great way to get a green card. And I think the superintendent also mentioned that some people are requesting IEPs for that purpose. So again, it's not your job to advise people on the legal aspects of it, but just to say, you're asking me for a medical report and you're telling me it's because you're going to apply for the disabled child green card. Let me just advise you to go get some immigration advice. Go to a reputable lawyer. Here's a list of nonprofit organizations in this area. So just at that level, make sure that you're kind of spotting those issues and sending them out in the right direction. Public charge, we talked about a little bit earlier. Nothing has changed in terms of the effective immigrant acceptance of public benefits and their ability to change status later, to adjust immigration status later. That may change. There's certainly been threatened that there would be changes. At this point, nothing has changed. It is still the case that health care benefits do not make you a public charge. They're not figured into that calculation. In addition, the fact that you apply for public benefits for your child does not count against your ability to adjust your status. So there are things that there's a lot of rumors about that actually haven't changed. And I think one of the more important things that you can do as trusted medical providers, as trusted sources of information, is to help stop rumors, really, to help people evaluate the information that they're getting, know what are good sources, know what are bad sources, and be a little more critical of that. Because in an area, at a time of this heightened fear, people are having difficulty evaluating the information they're getting. Maricela referred to the hotlines that have been set up. Every county in the Bay Area has a hotline, a raid response hotline. Every verified report from those hotlines so far has been of a targeted raid. So it's been it's a targeted enforcement action. So not a widespread raid, not a sweep. They're not walking into the grocery store and picking up whoever. They've walked in with a name of a person that they're looking for. And yes, they are now picking up collateral. They're doing collateral arrests of somebody who just happens to be in the wrong place, wrong time. But they are coming to a particular place with a particular person that they're looking for. So we have not hit a time where we're looking at widespread raids. Yet those rumors are out there. You will hear them every day. So far, the most important function of these hotlines has been to tell people that didn't happen. That's not true. ICE is not on the coast side looking for people. So those hotlines are now, as I said, they're now set up in every county. All the phone numbers aren't necessarily out there yet, but they will be pretty soon, and I'll make sure that we get that to our medical partners as soon as those are. I went to a rapid response convening on Monday, so they're kind of collating all those for the whole area, and we'll get those out to people. But again, your role in helping to kind of calm anxieties at this time is really incredibly important, because it is a really difficult time, and there are scary things out there, but some of the things that are feared aren't actually happening. So thanks to our hosts for having this great event. I've really learned an amazing amount today, so thank you for hosting. Clicker.
Good afternoon. All right, I'm last. No pressure. Luckily, I'm a fast talker. So I really appreciate the opportunity to be here today. Thank you, Fernando, for bringing us all together. Most appreciative. I'm Lisa Chamberlain. I'm a pediatrician. And for the last 15 years, I've been working to coordinate a physician advocacy voice, to train the next generation of pediatricians about what it means to take a stand for your families, what it means to bear witness to their stories, to bring the data forward to elected officials, to help bridge what we see in clinic to what we know needs to happen on a broader scale. So that's kind of my job, and we've been pretty busy. I would say there's been an uptick in interest, just slightly, in the last few months. Obviously, our focus lately has been on immigration and the threats that we see with our families. Unprecedented threat to the Medicaid program, really untenable, what they're looking at doing to that part of the safety net. And in a broader context, talking about the increasing number of children that live in poverty since the Great Recession, what that has done to our families, increased the level of stress, and really been disruptive on a lot of levels. So that's kind of a little bit of background. I know it's kind of different to think of your physicians acting like this, but this is the next generation, and I think it's a really important shift. This is a definition by Mark Ernest, who's an internal medicine doctor in Colorado. He defines advocacy as action, physician advocacy as action by a physician to promote those social, economic, educational, and political changes that ameliorate the suffering and threats to human health and well-being that he or she identifies through his or her professional work and expertise. So all of our physicians are citizens and are activists in their own right. When they advocate as physician advocates, they're putting on a different coat. They're wearing a different hat. And that means speaking on behalf of their families, again, through the lens of what they've seen and what they know the health impacts can be. So this photo is actually docs up in from San Francisco, UCSF. We've led different nationwide days of action around cuts to Medicaid. This one was particularly about S-CHIP. We have really nice organized signs. UCSF always has to do their homemade ones. Elena, I don't know what's up with that, but it's San Francisco. They're kind of radical up there. I'd say that even though we have done these things nationally in response to mostly cuts to access to care, we were approached in January, and when I say we, all of this is done with Sherry Sager, our Chief Government Officer for Government Relations at Stanford, who's unbelievable and mobilizes all of us and helps us to be even better than we ever thought we could be. So we were really approached by our residents, the physicians in training, and said, we have to do something. Our families are so scared, we just are so frustrated. And I do think this advocacy work helps with physician burnout. You internalize these stories enough, you start to take them home and feel bad, and this gives you something to do about it. At our national meetings recently, Mark Del Monte, who's the chief lobbyist for the American Academy of Pediatrics in DC, said, all of you doctors, you're like a Porsche up on blocks. Your engine is revving, revving, revving. Let me go, let me go. And that is what the residents feel like. They can only take so much. So they said, what are we going to do? We have to do something. And I said, Sherry, what are we going to do? We have to do something. So we called a town hall meeting and invited all the faculty, all the staff, all the fellows, all the residents to come one evening to talk about what the threats were. We focused on immigration, cuts to Medicaid, and cuts to child health research. Fernando gave a presentation, Dana. We all talked about what we saw from the political landscape, and then we just stopped talking and said to the docs in the room, what do you guys want to do? And we brainstormed for an hour. And what they said they wanted to do was build a rapid response team. We didn't steal your name. We came up with the same one. And what has come from that has been a lot of fun action. So we've been mobilized to make a lot of phone calls and write a lot of letters. And we've tried to do it in what we're calling kind of a precision advocacy way. It can be frustrating to be here and want to reach out to your senators, but they say, thank you, we agree. And so you kind of feel like, is this helpful? Is it authentic? So we were able to map out where we thought the important conversations needed to happen, what offices needed to hear from us. And we're not necessarily constituents in these offices, but our residents and our faculty know people nearly everywhere. Oh, I went to school in Texas. Oh, I know people in New York. So we were able to reach out and mobilize all of our connections to do precision advocacy and say, please explain, call this person, explain that this is a threat to child health. This is a threat, and this is around the healthcare reform that was going on. So we've been doing a lot of precision advocacy around that. We've been attending town halls. Our physicians have been going in their scrubs and their white coats. This was SU's town hall, and our resident afterward was getting interviewed by NPR. So we've been trying to raise the conversation around the impact that these cuts will have on children, and raise the importance of families in the policy deliberation. As we started thinking about the threats to immigration, one thing that came up was the importance of the story and all of the things that people were hearing. And so we've created a story bank, which is a secure Google Doc, basically, that all of the physicians can go on and fill in the stories of their families. And these are some that have just come in. I saw a young patient who was unable to get brain imaging studied despite having weakness, finally came to the emergency room and was diagnosed with a brain tumor. I saw a toddler-aged boy with elevated lead levels. The mother did not want the Department of Public Health to come into her home to evaluate where the lead was coming from due to concerns about deportation. And a mother of school-aged children with terrible mouth sores was afraid to come to the doctor or the emergency room because she was worried about getting deported. She was so scared to come in that by the time they arrived, the children were severely dehydrated. So these were just 3 of so many that we have, and we are collecting them constantly. And our question is, what do we do with these? We want to bring these stories to the decision makers. At the same time, we have to be really careful not to create targets of our patients, because these are people who are vulnerable to the fact that they are coming to our clinics, they are coming to our emergency rooms. We don't want to, create any kind of vulnerability on that side. And so we're working on that right now. This is something we're trying to figure out in real time. Our thought is to take them directly to our elected officials in private conversations, share these stories. These are your constituents. These are people who live in your district, to make it real for them without it being something where we involve the media. But this is something that I think is can be quite effective because it brings that voice of the impact into the room. And I think that as physician advocates, it's our job to help bridge that and bring that voice to that conversation. So I'm interested in collaboration. I'm interested in talking to other people about what we've done. I think that I hope we get to a point where children's hospitals or medical organizations who are not doing this kind of work are practicing malpractice. I think it is the obligation of physicians to stand with their families and practice in this way. So other people who are interested in learning about how we've done it and what we're trying to do, and I'd love to learn from others who are doing similar things. So thanks again for the invitation. Appreciate it.
Wow, thank you guys. Truly amazing, powerful women here. We have time for a few questions. Are there any questions here? First, Steve.
Hey, Lisa, thanks so much for your comments. We live in an echo chamber here. I sometimes, look around and I feel like I'm talking to the converted already.
Yeah.
How do you get out of the echo chamber? Where do you go to get out of the echo chamber? Are you interested in targeting the congressional Republican delegation from California that voted in favor of the health plan?
Absolutely, absolutely. So in that precision work, yeah, go ahead.
That would be precision work.
Yeah.
Just your thoughts on that.
Yeah, no, it's a great point. So in 2007, we reached out to the other 17 training programs in California, and it's really handy because there's one at Children's Hospital Orange County, there's one at the Valley, at Valley Children's in Central Valley, and UC San Diego. So we have physicians and residents in those programs who have relationships with those staffers, and when all of this was happening, Sherry was like, Lisa, call Orange County, call the Valley. So I think it's important, you're absolutely right, and thankfully we do have a network, but it could be stronger. Sherry, yeah.
We talked earlier today, you heard from other speakers as well, the importance of stories. What neither Chris or I have said is we just came back from Washington, D.C. And though the main topic was not the immigration issue, we did mention that, tomorrow we're going back and doing a summit on immigration and its impact on children's health. It was on the AHCA. But in every office we went to, they asked us for these stories. So when these stories then get compiled, is when we give it to them individually, so then it's not even associated with a hospital or a region, especially to a senator. It could come from anywhere in the state. So these stories are really important. And I'm going to tell a story. So one of our residents who is part of the rapid response team comes from Kentucky. So for the last few weeks, every week she says, I call Rand Paul's office and say, vote no on the AHCA. So this week I called his office and I actually talked to the health staffer and told him all my reasons why Senator Paul should vote no. And he said, well, at this point he's a no vote, but not for any of the reasons you said. And she said, that's okay, it's still a no vote. It makes a difference.
Lisa, could you and others, Elena, and others speak about what our pediatric societies are trying to do? Because aside from our residents and all, to me, this is a professional issue for the health and well-being of a large portion of our children.
Right. So I would say that the American Academy of Pediatrics has been really forward-thinking on this. And you know more than I, a lot of my colleagues are involved in the Immigrant health group and have come out with very strong policy statements. They did a very visible tour to Texas, had a lot of media coverage about the treatment that the youth that were coming, the threats and the situation where they were being held. So I feel like the AAP has done a really impressive job. I don't know if other people know better than I. Yeah, Bonnie, please.
So Karen Remley, the new CEO, has really revamped and revitalized the academy. I'm on the I forget now what it's called, it was this, the health, the rights of, the
Rights
Bill
and-
of Rights
to
for
the-
Children, that's what it was.
yeah.
Bill of Rights for Children, and it was agnostic to who the outcome of the election would be. Of course, we all thought it would be different, but it was still very, very specific. It was a really well-written and well-thought-out document, and they were waiting to deliver it to the president. So the day after the acceptance, they actually sent this document to Trump and said, "This is what we believe regarding children's rights, and we are happy to engage with you." So they've really been working very hard on the Hill.
Yeah, agreed.
First of all, thank all of you for your advocacy. I in particular wanted to thank Ms. Gutierrez. I know when we, the very beginning, like way back in January, were organizing a Know Your Rights event here in Palo Alto, and you immediately responded. We could not find anyone locally, but you responded and came up here for our panel, and then we held another one recently. Dr. Chamberlain, I've known you for many years, and I just wanted to know how people in the community, and also being a nurse, nurses can also help the doctors and physicians and residents as well, because I think the larger the group who can help and respond, the more powerful we can all be. I have not heard about this group, but I'm so happy to hear about it. And also, having worked a lot with behavioral health doctors here at Stanford and Packard, I'm just wondering if you are also working with behavioral health, because the previous speaker, Dr. Matlow, there is a group over there who I know are trying to respond. I was at one of their meetings to respond to Ravenswood in particular, and the fears of their children, and to come out to the schools. So I'm just wondering.
Yeah, no. Yeah, it feels like a room of old friends. It's wonderful. We should do more. I mean, we really should be thinking about how we build bigger networks. And when we have these days of action where it really the number of people there matter in terms of the press, I think that it would be much more effective to have a larger group. So I'm wondering if this group, in terms of knowing who's here, and I know we have emails, if that would be something people would be open to in terms of reaching out when we are going to have days of action. Maybe we could think a little bit about that, Fernando, because if people aren't interested, that's totally fine. But I do think for people who are interested locally, that would be a great idea. And for people who have come from other institutions, really interested if you want to connect with me, with, I'm sure, Dana, in terms of trying to make sure that these kinds of activities are happening in programs across the state. I think the more we've got to work together, if not now, when, really.
Thank you, Fernando, for the comment. In my role as president of the American Pediatric Society, I would say that the American Pediatric Society, the Society for Pediatric Research, the American Academy of Pediatrics, the Academic Pediatric Association, all of us, we care about different aspects of child health, family well-being, the policies, whether it's the preservation of academic medicine in children's hospitals, whether it's Medicaid, whatever. We all have we're all family, and we all need to speak up and share our voice. So the APS is certainly playing a part, every organization, and many of us belong to multiple organizations. But I think we have to just keep it up, keep speaking out, keep sharing stories in a good way, and hopefully we will make meaningful change.
Hi, just getting back to the AAP and the organizations and what they're doing. So the AAP's top 3 resolutions are related to immigrant health. So if you get a chance to go there and read them, and there will be some policy statements and some guidelines and recommendations that come out with those resolutions. Additionally, June 1st is International Children's Day, and the advocacy leaders in the AAP, along with the International Health Council and the Immigrant Health Special Interest Group and other such groups have gotten together. And there is an advocacy toolkit that will be released as well that will go through recommendations and guidelines or suggestions for op-ed pieces, media pieces. It has a lot of resources on there to kind of help your organizations if you wanted to organize and do something collectively with all your colleagues. So there's a lot going on, and there's a lot coming down the pipeline. But that look out for that. That's coming through.
Thank you.
Hi, Myra Alvarez with the Children's Partnership. I have a comment and a question. First, one thing that we have definitely recognized is that the progress California has made to cover all kids, regardless of immigration status, was a shared victory between health advocates, child advocates, and immigrant advocates. Seemingly different organizations that banded together and crossed the finish line after decades of work on behalf of separate groups. I think moving forward, that same diverse coalition of advocates has to unite around protecting the Affordable Care Act or defending immigration, you name it, climate change. That same strange bedfellows have to come together and stay united, which isn't always easy, given that all of us, stay in our silos. I wanted to make sure folks were aware about the website healthforallkids.org. That's a website that serves as a central repository where a number of organizations put resources in order to try and make the information more digestible. So my question to the panel is, how do we not fall back to those silos and ensure that these kids are all of our kids, regardless of the label that we may wear from our organization, in order to build on the progress that California has made and make sure that when push comes to shove and we've got cuts to Medicaid, which are likely inevitable, that we are prioritizing the needs of the most vulnerable kids in California together.
Talk a little bit about like healthcare alliance.
I'll start that.
Great question.
Yeah, it's an excellent question, and I actually really applaud Fernando for the idea of this summit because it's the beginning of what can continue to be a much larger cross-disciplinary, and we learn so much from each other when we have a summit like this. So thank you to Dr. Mendoza. The medical legal partnership, we just talked about our one medical legal partnership here, but there's hundreds of medical legal partnerships across the country that are also doing some of this networking, and it's medical legal versus healthcare providers and the legal profession, but it also includes a lot of the social work and the nursing professions, et cetera. So I think those are some, and our legal partners really connect us with a lot of other community organizations that they work with. So we do take what we're seeing here and try to connect with others, but it's a much larger issue of connecting with so many different people. Like, I had not heard of that website, so that would be a really useful resource for us and our families. Do you want to talk at all about Healthcare Alliance or anything like that?
Dana wants me to talk about the healthcare alliance. I know. Legal Aid Society of San Mateo County is a partner in the Health Consumer Alliance, which is a statewide network of legal services organizations that help health consumers. And we have lobbying resources that are working on this, who know this stuff much better than I do. But definitely from the legal side, there is a health advocacy component that is active on this and is ready to partner on all of these issues. And we're very interested in talking about that.
I'll just add that at Stanford, our residents are interested in reaching out to the university. So if there are people here who are interested from just across our university, it's embarrassing. We don't even all know and work together effectively. But I want to echo what Dana said. I think we should think of this as the inaugural summit. And so, Myra, do you want to host the second? I think, seriously, we need leadership. We need a vehicle to get behind, and we need leadership. Those are the two things. And I think that the Child Advocacy Committee, the community, our biggest liability is that we are fractioned, and we tend to fight for what we perceive as pieces of the same pie. Whereas if we can come together, I think we can be much more effective. And so I love the idea of moving into phase 2 and using that conversation and that time together to say, here are 3 big opportunities. This is how California is unique. This is what we could leverage. What could we all, roll up our sleeves and work together on? I think it would be an example for the nation, and frankly, I think it would be hard to stop us. So I think we should think about how we build on this momentum. Absolutely.
I would say for the immigrant rights and refugee rights organizations, we're doing a lot more of that, especially at this moment, like really looking at cross-sector, intergenerational, multiracial building. One of my favorite saying is that if one of us are not free, none of us are free, or all of us are free. And so for us, it's taking a stand on environmental justice, women's rights, LGBTQ rights, children's rights, all of that, speaking publicly on issues that are affecting immigrants today is really important to come from the American Pediatrics or coming from Stanford University to publicly support policies that are supporting deportation defense funding, that are promoting sanctuary states or sanctuary cities. All of that from organizations that traditionally don't support that work is really powerful.
Any other questions? I want to take this opportunity to thank this phenomenal panel. This has really been inspiring to so many of us, and as Lisa and Dana and Maricela and Stacey have mentioned, this is a start of moving forward, not the end. So please stay in touch, but please, round of applause for the panel. And to close our session, before we bring up Fernando Mendoza, I think he deserves a phenomenal round of applause for pulling us all together. Fernando.
Applause to all of you because you're still here almost 5 o'clock. So I was thinking what I should say at the end. I think that we put this together first because of the common ground that we were concerned about kids. You know, that's our future. We deal with them in many different ways. But when one sees the kind of situation that we're seeing right now with the issue of immigration, it does reach the soul, doesn't it? We heard that underlying theme throughout these talks, that it was an emotional situation, that we all felt some pain. We all felt, you know, why is this happening, right? This is America. Would you ever consider this situation to be happening in this country? To have the most social disruption we could ever have by having kids lose their parents, by coming home from school and not seeing your mother? I mean, think of what it means to us if one of our kids was gone, or if we went home and our parents weren't there. There's probably no more emotional stress to a child than that. Because your parents is there when you're born, right? So that link, it's such a crisis when we start talking about taking that connection away. That said, we need to deal with this in a semi-rational way, in the sense that we need to use our heads, not just our hearts. So this conference was put together with that intent. It wasn't to tell you, do this or do that. It was to say at the end of the day, here's what we know. Here's the demographic. Here's the data of what this country looks like, what it's going to look like, right? Here's somebody that has dealt with the law. This is what the law means and doesn't mean. Here's research we can do that can actually make a difference to some, right? The fact that good policy gives good health. That's something we don't always hear, nor do we always see. To see people that are committed, like our supervisor, our president of the Board of Supervisors, for the last decade, to say all kids are valuable, to say no child in Santa Clara County should be without health insurance. That was dramatic. And it wasn't by physicians, it was by people in the community. We hear the effects of what happens when you have policies that are mean and very disruptive. How does it affect hospitals? How does it affect clinics, public health? But even schools, the day-to-day function of schools, how does it affect them? We can understand what the health and mental health, perinatal health, all that means. And some of that we can tell you as researchers we don't know, right? But it really just says to us, what we don't know, we should learn, because indeed, if we're really caring about kids, we need to know. And then lastly, what can we do? What's our responsibility? So you heard responsibilities from leaders in the community, physicians, lawyers, right? Now, why do we share that responsibility? Hopefully because we all care about kids. And I think that at the end of the day, is the American value. We are being challenged to say, what are the American values, right? We have to give voice to those values. And voice not only to the people that run our government, but voice to the community, right? You are the voice of the people that can't speak. But you also have to give the voice back to them to understand that we care as institutions. Because I think it is very easy to end up being silos. We end up today, probably for the first time, talking with people that we never talk with. And that in itself is sort of an unfortunate situation. But sometimes, you know, no pain, no gain. Here's the pain, that we have to live through the situation. The gain can be that we live through it, but we live through it together. We live through it with the idea that all kids have rights, that this country, at the end of the day, is really not going to put up with the kind of things that we're seeing. And I think the only way we can do that is to make sure the country sees it, to hear these stories, to see the commitment by young physicians and old physicians. But I think that to me is what made this, you know, country great. I think about at least my parents in the Depression period. You know, people just kind of said, well, we're going to get through it, and we're going to do better. You know, the only thing we have to fear is fear itself, to some degree. That's still true. We need to see the positive aspects of what we can do, and we need to understand that at the end of the day, we're doing it for the kids, and those kids are our future. So I want to thank everybody for coming. It's been a pleasure to work with you, and I hope we do this soon. Thank you.